What's up, everybody? This is the most difficult YouTube video I've ever had to film. On February 7th, 2023, I was diagnosed with stage 1 invasive ductal carcinoma, breast cancer. And it's really difficult, being that I am also a traumatic brain injury survivor that has post-concussion syndrome. This is like a total slap in the face that I just went through these past 2.5 years of having to deal with going to physical therapy and trying to figure out everything that's wrong with me, and now getting hit with breast cancer. It's like the worst feeling ever. This is my story of how I found out I had breast cancer. Back in December of 2022, I went to my PCP to get results of some other tests that I had to do, because I'm constantly getting tests for all the brain injury stuff that I have to deal with. I noticed that one of the bumps around my areolas was just slightly firmer than what it usually seems to be like. And I had just also done my yearly exam at the gynecologist, and she checked my breasts as well. She said everything was fine. So I asked my PCP to check it out and see like if she could see anything. She checks it out. She says, I don't think it's anything. She's like, but if you want peace of mind, I'll send you for a mammogram just in case. So I'm like, fine, I'll do it, because I already go to so many doctor's appointments. I do about 15 doctor's appointments per month. So it makes it impossible for me to work for an employer. As well as in the past 8 months, I have had 8 different medical procedures. I had to get injections into my spine for arthritis in my hips. I had to do injections into my legs because I have peripheral vascular disease in my legs. So I have issues with circulation. All right, so now we're gonna get the compression stocking on. I got the orange goo. What is the orange goo again?
It's just to make sure your leg is clean.
Oh, there we go. I previously thought it was blood, so check this process out, you guys. I did a compression stocking. Oh, fart sounds. So I got a black stocking this time. Last time it was a nude color. I think black is better. It's like a New York thing to have black. And I also got an EEG for my brain recently to try to figure out if I am having strokes or seizures, because they're still not sure which of the two I'm having, because certain symptoms that I have line up more with strokes, certain symptoms that I have line up more with seizures when I do get these neurological episodes. So we're still all trying to figure all that stuff out. I went to my PCP. She tells me she's going to send me for the mammogram. About to get my mammogram. I went to the place to go get the sonogram and mammogram. They first did the sonogram, and I had to leave the same day to do the leg injections because I have so many appointments. It's very hard to line everything up perfectly, and they were running up behind on schedule, so I had to leave to go get a medical procedure. So they told me without doing a sonogram and a mammogram together, they couldn't give me like a full diagnostic. So they scheduled me to come back like 2 weeks later to do the mammogram. So I did the sonogram first, and then I came back 2 weeks later. At this time, I didn't assume I had anything. I'm just like, let me just make sure everything's good while I'm dealing with all this health stuff. So I come back and I do the mammogram, and they give me these stickers, and they say, you know, you assume you have something on your left breast, put the sticker on where you think you see something or feel something. So I put the sticker on my breast where I thought I felt something, and they do the mammogram. So they got a new mammogram machine, and this one holds your boob right here on the shelf, and this part squeezes it. Yeah, for boobs. Then I was called into a room, and they were going to give me the results, and immediately I could see from where I was sitting that on a computer screen it was written that it was an abnormal mammogram. So the doctor gets on the phone and she says, don't like be worried. Abnormal could mean that it's like something else, but we do see a mass there, and we do want you to get a breast biopsy. Just to be sure that there's nothing wrong. I'm a little freaked out, and I get the biopsy done. I just got done getting a breast biopsy, and it's like a whole pig bandage under my boob area. The craziest part is where I thought I felt something was completely different than from where they saw the mass. So originally I thought I felt something here in my breast. Where they found the mass, it was all the way up here, right? And it comes back as cancer. Tell me that I have breast cancer stage 1A. My cancer measured at 1.3 centimeters at the time. If you don't know anything about cancer, cancer goes in stages based off of the size of your tumor. So 1A means that it was the smallest size for that stage. It was A, B, C, right? Needless to say, like, I ended up like on a mental health spiral after that. Bandage is way bigger than the site. It's actually the size of like a beauty mark. I don't know if you can see the beauty marks on my arm, but it would literally be like the size of something like that. The whole of how they do the biopsy. And basically it's like a large needle gun, and they shoot it from upward over so you don't have a hole right in the top of your chest. And it's they put something in called a clip. And a clip is about the size of a grain of rice. So I got a clip there. After that, I had two more appointments at the cancer hospital. I got 3 appointments today. I got a mammogram, an x-ray, no, a mammogram, a sonogram, and something else I can't think of right now, but they're gonna be testing me for genes and to see where I could have possibly gotten the cancer from. So it's just a lot happening today. And then after I get all my appointments done, I have to go and meet my oncologist to see what she says. The most nerve-wracking part was when they did the full diagnostic of my breast. They saw something on my right breast now, and now they needed to do a biopsy on my right breast to confirm if I had it in my right breast as well. I'm about to get another biopsy done, and this is where I was marked. So yeah, wish me luck. You all are gonna have to forgive me because I just got really emotional and cried a lot. But I want to show you guys what it looks like after doing a biopsy. So this marker here, this is where the mass is, and this is where the incision site is, where it's supposed to heal, so that it's less obvious that they took a sample. And when these bandages get removed in 7 days, it's just gonna look like a small hole, like a beauty mark. But yeah, that's breast biopsy. As it turned out, in my right breast, after the biopsy, they found something else called fibroadenoma, which is a non-cancerous tumor, which is good because then that eliminated the fact that what they assumed in my right breast was cancer, that it is not cancer. So the scariest part was the third part, which is the MRI, because with a mammogram, with the sonogram, it can only show so much about your breast. The truth is the MRI. The MRI will spot out any cancer anywhere, and you will know for sure if you have it anywhere else. I was shaking inside the mammogram machine. Like, I have never been so terrified in my life. The results came back. They were actually very good. It showed that I did not have cancer anywhere else other than in the one spot on my left breast. My cancer is about the size of a grape, and it is roughly right here on my left breast. Because the MRI also showed that the cancer is just in one area and hasn't spread throughout my body, the proposed treatment plan was to do a lumpectomy and then radiation, along with 5 years on a estrogen reducing pale. A lumpectomy, for anyone that doesn't know, is when the tumor is small enough they can go in and just take it out. A mastectomy is when they chop your tits off. And that's what I was most scared of. I also do something called margins, which is where they remove extra area around the tumor to ensure that they are getting everything. So I asked the doctor's assistant, I said, is this gonna reduce my breast like by a whole cup size? And she said she doesn't think so, because what they do is they do something where they move the tissue around inside the breast to try to fill up the hole or the gap. It's a little bit nerve-wracking knowing that, you know, it's your body, and that, you know, it might not look the same, you know, going into that. They want to put me on radiation for about 3 to 4 weeks. The reason why chemo is not on the table is because it has not spread throughout my body. It's just in one isolated area. With that being said, my situation gets even more grim because they cannot operate on me. And the reason why they cannot operate on me, they have no medical clearance. In my accident with the garage door coming down on my head, it damaged my skeletal muscular system in my chest right here. And this part, they have been trying to get me to breathe normally for the past 2.5 years. I've been prescribed different inhalers, and from the very first year where they checked my breath, I was breathing at a rate of 50%. After that, the second year, they rechecked my breathing, and I was up to 58% with the medications. And now, only breathing at a rate of 61%. For me to survive surgery, I am supposed to be breathing at an oxygen rate of 75%, which means that if they tried to remove my tumor, I would likely die on the operating table. It was a really difficult time in my life. I've been going to the pulmonologist, and the pulmonologist has not given me medical clearance for surgery at 61%. He put me on an oral pill, and he also put me on a much stronger inhaler. Tomorrow I'm going to go back to the pulmonologist, so we have to see if he's going to be able to clear me for surgery. But if he doesn't, then I'm still scrambling, trying to get my lungs to breathe at a sustainable rate so that I don't die on the operating table. And this video was extremely difficult for me to make because when I first got diagnosed, there wasn't a day that went by that I just didn't break down in tears and just cry. I'm also leaning towards the side of not pursuing radiation. And the reason why is that radiation can also cause damage to your cells. It can also leave burn marks which turn your skin black. It can also make your hair fall out. Also, no guarantee that no matter what you do, whether you do radiation or chemo or do everything that the doctors tell you to do, that the cancer will not come back. That being said, also the medication they want to put me on can aggravate strokes. And being that I don't know for a fact if I have seizures or strokes when I get my neurological episode, it's a risk to take the medication that they would prescribe me. And even the oncologist is baffled. She's like, I don't know what to do. Also, when you do these cancer treatments, you become infertile. Currently have not had the chance to get better and have children. I've been looking into non-toxic cancer treatments, and there is a cancer clinic in Mexico that treats cancer in a non-toxic way. Some of the treatments that they've mentioned that they would do is infrared light treatment, which is a light that penetrates through your skin to heal the area. They also do immunotherapies. They do something else called photodynamic therapy, which is a photo of the inside of your body, which takes pictures of where else the cancers could be remaining. The whole program lasts about 3 weeks. You're also educated on cancer and how to rebuild your immune system to fight cancer. And you're not, getting sick and lethargic the way you would if you do chemo or radiation. The whole treatment plan would cost about $42,000. Plus, I would have to pay for the flight to go down there and have extra spending cash just in case. Altogether, we'd probably be looking at like $46,000 to $48,000 just to get down there and ensure that I could get the proper treatment that would not further damage my body, because my body's already been through so much. It's not like, oh, you just have cancer and this is the only thing you have to deal with. No, like I still have to get physical therapy. I still have to get treatment for all the other things that I need treatment for. So the whole situation is just crazy, because there's possibility of me passing away if I get surgery. But if I don't get surgery, the cancer could grow. The Mexico clinic also did mention that they would take me as a patient whether I got the lumpectomy or not. I'm leaning more towards getting the lumpectomy at this point, to remove the tumor and buy myself some time to come up with this astronomical amount of money so that I can get to Mexico and do the treatments that I need to do to save myself and prevent recurrence. And this is just the beginning of my story, so I hope you guys will stick around and see what comes next out of all of this. Thank you so much. I love you guys. Bye bye. Take care.